Good morning, ladies and gentlemen. Welcome to the 40th anniversary and annual meeting and symposium of the Philippine-American Academy of Science and Engineering, parallel session 5.3 on education development, sector, and media. I'm Gisela Concepcion, and I'm co-hosting today's session with Professor Emeritus Asuncion Raimundo of UP Los Baños. So I'd like to tell you a little bit more about 40th APAMS, which we call this series of webinars that's running for 4 weeks. We started on July 20 and we will end on August 14. And we have them every day, Monday to Friday, from 8 a.m. Philippine time to about 10 or 10:30 a.m. And we started with great sessions, parallel and three parallel sessions and plenary sessions. And we're on our 8th day today. So there are many more talks, many more activities that we hope you would join us in. There are over 200 oral presentations. We have about 50 poster presentations, and we have 8 group discussions. So, as the video showed, PAASE is committed to trying to help move forward science and technology in our country and the rest of the world. So many of our members are from the Philippines, but PAASE originated in the United States, and there are very many members there. Now we also have those coming from other countries in the world. So today we are faced with a major challenge, and this is to cope with the impacts of COVID-19. And we are most concerned about its impact on education. Well, PAASE is composed of researchers, scientists and engineers. We're also committed to science and engineering and math and art education. How can we sustain progress and development? How can we sustain R&D without continuing to educate our youth at all levels, at the basic level, K to 12, at the undergraduate and postgraduate levels? So today, Dr. Raimundo and I have tried our best to come up with a lineup of very outstanding educators and researchers from different parts of the world to share their knowledge with us on how we can innovate to improve education. And mostly we think that online or remote learning would be the major mode. Luckily, we have some experts in these areas. So I hope you stay with us and join us actively in our Q&A open forum. And at this point, I'd like to begin by introducing our special guest lecturer. This is Dr. Iris Isip-Tan at the University of the Philippines. Let me just prove this. Of the College of Medicine in UP Manila. She is also chief at the University of the Philippines Medical Informatics Unit and director at the University of the Philippines Manila Interactive Learning Center. She is a practicing internist endocrinologist with a master's degree in health informatics and telehealth. She believes in the scholarly use of social media and is currently enrolled as a PhD student in health sciences by research, with her work focused on social media misinformation. I'm very proud to say that Dr. Isip-Tan is our first prize winner of the first UP System Gawad Pangulo Progressive Teaching and Learning Competition several years ago. So thank you very much, Dr. Iris, for accepting this invitation. I'd like to let you take the floor at this point. Thank you. Thank you.
Good morning, everyone. So I'm just going to put up my slides. So good morning. I would like to thank Dr. Gisela Concepcion and Dr. Asuncion Raimundo for the opportunity to speak today. My interest in the use of social media in healthcare began in 2012 when I started my Facebook page, The Endocrine Witch, as an experiment in making information about common endocrine diseases such as diabetes and goiter go viral. It was part of a personal advocacy on patient education and improving health literacy. Today on this panel on education sector development in media, I'd like to discuss how we leverage Facebook to counter misinformation about diabetes in the time of COVID-19. So I've divided my presentation into 3 parts. First, to recognize the Facebook filter bubble, to counter the COVID-19 infodemic, and lastly, the need to establish an infodemiology community of research and practice. So to begin, what is health misinformation? It is a health-related claim of fact that is currently false due to a lack of scientific evidence. APAMS, a US-based nonprofit organization called Facebook, the epicenter of coronavirus misinformation in a report last April, alleging that Facebook was not doing enough to protect its users. While misinformation may be unintentionally false, this information is intentionally false and spread deliberately. Even before the COVID-19 pandemic, Facebook has faced pressure to curb anti-vaxxer groups on the platform that serve as the breeding ground for vaccine disinformation. So recognize that filter bubbles are formed by the Facebook algorithm. Your Facebook feed is curated and tailored to your individual beliefs, partisan bias, and identity. Why is that? Facebook wants to keep you engaged, so you only get shown information that conforms to your beliefs, trapping you in a bubble of intellectual isolation. Within such information silos, the risk of amplifying misinformation within a closed network therefore increases. And that is not only a serious threat to democracy, but also to patient education and health literacy. Why? Well, because in a 2013 survey that included the Philippines, China, Korea, Singapore, Malaysia, and Taiwan, 9 in 10 had accessed the internet looking for healthcare information. And aside from the usual general healthcare websites, 25% of Filipino respondents said that Facebook was a health information source. I'm a physician, and that scares me. When the Spanish flu happened in 1918, we didn't have Facebook or Twitter. But now, perhaps because of social media platforms, an infodemic is accompanying the COVID-19 pandemic. Infodemics, according to the UN, are an excessive amount of information about a problem, which makes it difficult to identify a solution. They can spread misinformation, disinformation, and rumors during a health emergency. Infodemics can hamper an effective public health response and create confusion and distrust among people. This is a panel on education sector development and media, and so I must ask, are we able to teach digital citizenship to our learners that they can discern misinformation? The 3 S's are the guiding principles of digital citizenship: safe, savvy, and social. Safe, are we teaching our learners how to protect others and themselves while online? Savvy, are our learners educated users of online platforms and tools? Social, are we teaching our learners to respect themselves and others while interacting online? So we need the 3 S's of digital citizenship to counter the COVID-19 infodemic. So this is my 8-year-old Facebook page, the Endocrine Witch, which has about 154,000 followers. I have 76 one-minute videos on diabetes and goiter, and that's why my tagline is, "Isang minuto para matuto kay Doc Brew." As an aside, this being a panel on education sector development and media, I am hoping that institutions will consider the scholarly use of social media in academic promotions. We need academics to come down from their ivory towers and engage with the general public online to counter misinformation. Going back, Luzon was placed under enhanced community quarantine March 16. Unable to follow up with their doctors, those with diabetes began posting queries on my page related to the substitution of insulin, lessening frequency of insulin injections, and switching to generic brands for oral medications. At around the same time, Philippine Society of Endocrinology, Diabetes and Metabolism, through its Diabetes Advocacy Council, realized the need to educate persons with diabetes about the relationship of COVID-19 to diabetes as a number of cases began to rise. A slide deck in English and Filipino was converted to photos and placed in a Facebook album at the Society's page. And by March 22, I had gotten in touch with the PSEDM and helped to assemble a team of 36 Filipino endocrinologists from all over the Philippines to launch a social media campaign. I had long campaigned for the society to be more active on Facebook before, and with limited success. And so it was important to document the process in order to institutionalize this for the organization. And you can see the workflow on the slide. So an informal content analysis was done based on the queries to my Doc Brew Facebook page and also to the questions posted on the Philippine Diabetes Support Group on Facebook, which is the largest diabetes support group for Filipinos. I think it has around 16,000 members at the moment. And we did that to identify the health information needs of persons with diabetes. When we had these topics, they were then assigned to each of the 3 teams, and each team had content creators, translators, and graphic designers who were all Filipino endocrinologists, and they worked together using Viber and Slack. All slide decks were sent to the Diabetes Council for the PSEDM to review and feedback on before it was posted on the Society's Facebook page. Eventually, we wrote a paper about the social media campaign, which was published in the Journal of the ASEAN Federation of Endocrine Societies last May. Our objective was to determine the engagement rate of slide decks about diabetes on Facebook during the ECQ for the COVID-19 pandemic. So this is one of the slide decks that was made. Ano ba ang dapat kong kainin? Mga paalala para sa mga taong may diabetes sa panahon ng COVID-19. This slide deck also had an English equivalent. So there is a hierarchy of engagement for social media. Likes were considered low engagement because it was the simplest and quickest to do. You just hit the like button. Medium would be shares because you need to identify enough with the content to share it. And high engagement would be comments because you would need to reflect on the topic in question, draft the text, and then state your opinion publicly by commenting on the post. So Facebook provides page managers with the Insights panel, which contains statistics such as post clicks, comments and shares, and also reactions, which is the total number of likes, hearts, haha, wow, sad, and angry, those emoticons that we have. And then it also provides reach, or the number of people who saw the post at least once. and the engagement rate, the total engaged users divided by the total reach times 100. So the total engaged users will be the number of people who either clicked, reacted, commented, or shared the post. So these are only some of the slide decks because we had many. So here for my Facebook page, I'm only showing the 5 top slide decks. Okay, so the open circles plot the reach. So as you can see, that is the y-axis on the right, of the left of the screen. And then the blue bars plot the number of post clicks. So while many people might see the post, so that's the reach, not all of them will click on it or share it or comment or like it. So with millions of Filipinos on Facebook, the usual engagement rate of any post is around 3%. So as you can see for Doc Brew, the highest engagement rate was around 10% for a post that reached more than 56,000 people. The diabetes and COVID-19 slide deck. Now, when this post was shared on the PSEDM site, it even had a higher engagement rate of 15%. Now, I'm showing you the rest of the slide decks from the PSEDM Facebook page. Now, the PSEDM Facebook page only had about 5,000 followers, while I had 154,000. So the reach will also be smaller for the PSEDM, but as you can see, the engagement rate was still very good. Even with 5,000 followers, the engagement rate were still between 4 to 9%. So the PSEDM was, of course, very pleased with the results, and I intend to pursue this further. As was mentioned, I'm currently a PhD student in health sciences by research at the University of the Philippines, Manila, and my dissertation will focus on social media and misinformation in diabetes. Recently, with the group that had social scientists and the data scientists, we also had a research grant approved by the UP Manila National Institutes on Health to conduct an ethnographic and social network analysis of COVID-19 related misinformation in the Philippines on Twitter and Facebook. So the third and last part of my presentation is on infodemiology. So what is infodemiology? So the term is a portmanteau of information and epidemiology. Defined simply, it is the science of managing infodemics, according to the World Health Organization. However, a leading health informatics expert, Gunther Eisenbach, defines infodemiology more technically. He says it is the science of distribution and determinants of information in an electronic medium, specifically the internet, or in a population, with the ultimate aim to inform public health and public policy. This month, the WHO, the World Health Organization, held the first infodemiology conference on how infodemics affect the world and how they can be managed. So I am hoping that there will be more researchers or academe participating in infodemiology, because I hope that some of these research questions raised by Chu et al. Would be answered. Like, what is the threshold at which an intervention is needed to ameliorate the negative health consequences of misinformation? Does this threshold exist? How can clinicians and experts in communication create and sustain public trust in evidence-based health information? When I was starting with Doc Brew, some of the patients would follow up with other endocrinologists and they would ask their endocrinologist, is Doc Brew really an endocrinologist? Do you know her? So really, trust is important. You can surely agree with me that this trust in science, scientists, and public health experts have critically undermined the pandemic response. How can partnerships among clinicians, trusted social media influencers, and industry leaders be created? So I cringe when I am called a social media influencer, but with many confined to their homes because of the community quarantine, social media influencers, those who have millions of followers on Facebook and Twitter, can not only provide entertainment, but also encourage their followers to adhere to hand washing, social distancing, and the use of masks. Can the public be taught health literacy to help them discern facts from opinions and falsehoods. As a physician, I spend a considerable amount of time at clinic debunking misinformation. And I'd like to believe that my patients value my advice, but the same dynamics might not apply on social media. And so I was particularly concerned by this study by Zhang et al., where viewers of fake news on a social media platform were shown a debunking post. So basically they were told that's fake news and this is why. What happened and how did they react? Well, the viewers became less favorable toward the immediate source who shared the information, but they didn't blame the source, they blamed the social media platform. And if they particularly liked the source of the misinformation, they attributed the problematic behavior to the source's disposition, presumably to avoid internal conflicts and potential dissonance, and in the end, espousing even more positive attitudes towards the source. So it's not going to be very simple debunking health misinformation. And this one is not even about health misinformation. It was only really about fake news. So how troubling is that now for the COVID-19 infodemic? And so the outline for this presentation is also my call to action. Please recognize that there is a filter bubble on Facebook. Teach your students the same. Let us put the academe to work in helping to counter the COVID-19 infodemic, and maybe the Philippine-American Academy of Science and Engineering can help establish an infodemiology community of research and practice. Thank you very much.
Thank you, Dr. Iris Isip-Tan, for that very exciting, well, clearly very imaginative, creative way of educating the general public and moving towards engagement on very critical issues that affect our society today. So at this point, I'd like to open the floor for questions. Are there any questions from the audience for Dr. Iris? Because this is a very intimate group, we might even unmute a person who would like to ask a question. But perhaps Iris, oh, we have Dr. Raimundo with a question. I also have one. So Dr. Raimundo first.
Okay.
One, could we unmute?
That was a very good presentation. How can we teach ourselves and our colleagues to differentiate a fake news from a true, true fact? Because like there is a news going around that vaccine should not be entertained and all that, but we don't know how to go about debunking. I'm finding out whether that is there is any basis for that or not.
So when we teach our students, and for example, when they try to say that they got the source of information from this source, we ask them to triangulate. So when you find a piece of information, ask them, where else did you find them? And who wrote that piece of information? Is it an organization that you can trust? Or is it someone who cannot be trusted? Because some of us will just share something sometimes and not look at who wrote it, okay? So there are certain ways. You have to look at the website, who maintains it, is it up to date? Did anyone else say this? Or this is the only website that actually says this? Then you begin questioning. Sometimes they will quote certain articles, journal articles, and then when you click on the journal article, it doesn't actually say that, what is said in the article, in the post. So these are the things that we need due diligence, and we need to teach our students that as well. Not to believe anything at face value that's online, and to actually investigate and see whether these sources of information are credible.
Thank you.
Thank you. Are there other questions? So, Iris, I have a couple of questions, but I'll only ask one. And well, because I have some experience now teaching in the UP Open University, and it's a more formalistic method, but we are actually asked to make a lesson plan, and then we have questions that we would post to the students, and then we would have reading materials. So it's really more formal. And of course, the student is enrolled in a course uh, in a UPOU. But in your case, it's your students, and then you also try to address the general public. So I'm just wondering, how do you monitor and evaluate the the quality of the effectiveness of the communication apart from posts and comments? So you have your advocacy on diabetes. So how would you directly or indirectly measure whether you come across effectively? I think it's very challenging, but I'm sure you have that in your plan, okay, to monitor the feedback looping, right? Thank you.
Yes, ma'am. So the easiest would be to check the engagement. But then, as I said, for example, if someone with diabetes reads a post about proper diet, the good outcome would be if that person with diabetes will then modify his diet and adhere to diabetic diet. And that's what I'm aiming for as a clinician myself. But it's going to be hard if we just post it to the general public. So for my dissertation, I'm actually thinking of setting up a social networking group just for persons with diabetes. The plan is a participatory approach. I have been running Endocrine Witch for 8 years, and I am basing my posts from the questions that patients ask me at clinic. But I've never actually done a participatory approach where I show my post to a patient and ask them to comment on it or to ask them whether they understand it. So I'm trying to go for that kind of process for my dissertation because we need more input from patients. And when I do a post, for example, I'll know immediately whether they understood it or not because they're going to comment and ask more questions. Then it becomes clear to me, oh, I thought my post was clear, but it wasn't. So now I have to revise it again. So I'm looking for a more formal process where patients will actually be there on the table, I guess, creating this post together with the experts. Regarding Ma'am, the Open U, Ma'am Alisa is also here. The University of Philippines is now engaged in the creation of course packs, similar to what is being done at the UPOU, because for the first semester, we're doing remote learning. But in terms of social media, I have asked my students, for example, to go on Twitter to tweet their portfolio. So if I have like an assignment, I ask them to tweet a link to that assignment, which could be a blog post, for example. In that way, other people can comment on their output. That teaches them digital citizenship. Why? Well, because they'll be careful to make sure that they only use copyright-free images because they're going to share it so people can see. That's an anti-plagiarism built in because they know that the public will be able to read it. And then they'll know the kind of comments that they will receive, whether it will be favorable or not, how to deal with that. As you know, when I did the Gawad Pangulo, I said, I want to make learning visible, and that's how I did it. I was trying to make my students go online.
Thank you, Iris. There's another question here for you from Richard Tambalo. Thank you very much, Dr. Isip-Tan, for the very informative seminar. There are a lot of videos in Facebook and YouTube regarding medical issues and medicinal plant applications. Does the DOH or any government agency have a way to control or debunk questionable videos? And I think this is not just in the Philippines. It's claims in the Philippines as well as from all over the world, and they're mostly connected with advertisements. I mean, they have commercial interests. So, Iris, quick answer to that?
It's going to be very difficult to actually debunk all these videos because a new one comes up every hour, maybe every minute, and they're very savvy with the way they market these things. So what we're trying to do is instead of directly debunking them, because they're also powerful, they'll go after you. So what we have done is to establish our own credibility. So when I say I'm Doc Brew, I'm an endocrinologist. I'm speaking from my expertise, and this is what I say. I don't go to the page of that other person or other entity and comment there. I comment using my own page. Therefore, it's a matter of who will people believe now, the expert or this other person. So that is why I was saying earlier that I think academia has a role to play. We shouldn't be staying inside, but also going online, because our experts are the ones who know these things. But, you know, it takes also some sort of training, I guess, in media training or communication on how to put your points across that the public will understand. And that was the experience with COVID-19, right? When we say, is it droplet? Is it airborne? I mean, how do you explain it in easily explainable terms so that the layman will understand? So scientists need to have that kind of competency as well, how to explain things simpler. So no, I don't think the DOH will be able to do that or any government agency, but we can have our own social media campaigns in an effort to counteract that.
Thank you, Iris. So I think at this point, we have to underscore the importance of improving the basic scientific literacy of the general public. And so we have to start from the very early stages of education, youth education, and develop the ability of our youth and our young adults and the older population to discern what is reliable, accurate. But you're so right about social media giving the experts a chance to disseminate what they know about the subject. And I think that trustfulness to our experts should be developed over social media to combat all the fake news or false news or those with personal or commercial interests that's out there pervading the media. Thank you so much, Iris.